fluoroscopy of a male neonate with poor urine output. So let's start the observation. In fluoroscopy here, we've got two views. The first view is the bladder filling view, okay, using the catheter, okay. So here, this is the start of the bladder filling, okay. Can you see here the bladder trabeculation? Okay, this is the bladder trabeculation, which is seen in the bladder filling views. So bladder filling views show bladder trabeculation, okay. Also in the bladder filling views, you need to check for vesico-ureteric reflux, especially in a neonate, okay. So in the bladder filling views, there is bladder trabeculation, but no vesico-ureteric reflux, okay. So let's start the micturating views. I think, yeah, this is the start of the micturation, okay. So this is the micturating views, okay. Can you see here? Yeah, this is the urine and this is the micturating view with catheter removed, okay. So micturating views with catheter removed show what here? Abnormal dilatation of the proximal urethra. Abnormal dilatation of the proximal urethra relative to the more distal urethra with an abrupt narrowing in the region of the external urethral sphincter. As you know from the anatomy, this is the region of the internal urethral sphincter, and here the external urethral sphincter, okay. And this is the funnel-shaped dilatation of the proximal urethra, okay, with abrupt narrowing at the region of the external urethral sphincter. This means that there is an abnormal valve here. There is a posterior urethral valve here. Posterior urethral valve. Okay, so the diagnosis is posterior urethral valve. The management here, first you need to do more investigations. You need to perform ultrasound of the upper renal tracts. So we need to perform ultrasound of the upper renal tracts of the kidneys. Why? Because posterior urethral valve can cause bladder trabeculation from the back effect, okay? From the back effect can lead to bladder trabeculation here and vesico-ureteric reflux here, and the back pressure, it changes on the kidneys, okay? Can lead to hydronephrosis, okay? So we need to check for back pressure changes on the upper renal tracts, okay? So yes, we need to perform more investigations, more radiological investigations. We need to perform ultrasound of the upper renal tracts, okay? And yes, we need to refer the patient for surgery, okay? So this patient may need surgical referral as the posterior urethral valve should be corrected surgically, okay, to avoid any back pressure it changes on the kidneys. So I think this is the appropriate management here.